Welcome back. Another female doctor has been assaulted today, this time at the Lillian Ngoyi Clinic in Soweto. This at the backdrop of a horrible incident where two doctors were stabbed by a patient in Kimberley over the weekend. So clearly the safety of female doctors is a cause for concern. Our senior reporter Aviwe Mtila is tracking this story for us and joins us in studio. Aviwe, it's such a tragic story, these attacks on doctors. What happened today?
So today, Clement, we got a glimpse of the reality of these assault by patients to the doctors, especially the female doctors. So following that incident of stabbing of the two Kimberley doctors by patients, I got a number of calls from doctors wanting to detail their own personal experiences around Johannesburg. So we headed to the Lillian Ngoyi Clinic in Soweto, where we spoke to the doctors and they detailed the abuse that they've suffered. A lot of it has been verbal, but there have been incidents where they've been manhandled, even thrown with urine, some of them, and it doesn't end only at the doctors. Even the nurses and other healthcare workers detail how the weekends, especially the evening shifts, are the worst, having to deal with drunk patients, some of them not wanting to even adhere to the protocol or wait in line, wanting to be served immediately, even if the doctors aren't available, attending to other emergency patients, how they then manhandle the healthcare workers themselves. So after hearing these terrible ordeals, we then moved on to our next interview. But within about 10 minutes, Clement, we were called back by one of the doctors saying that Dr. Mandisa Kubeka, a doctor that we had interviewed, was actually herself assaulted just moments ago by one of the patients. So we rushed back, and when we got there, we saw a visibly shaken Dr. Kubeka, who then detailed the experience of how she was slapped with one of those patient files moments ago by one of the patients. Let's take a listen to that.
Stormed, he kicked the box, the sound, it sounded like it was a gunshot. I was scared. I didn't want to be here anymore. I don't want to work under these conditions anymore. When is anyone going to hear me, hear us? I showed him, guy, there's a notice. It's not from me. It's nothing personal. But still, he had the audacity to insult me for something when I was right.
What was he doing? This is 20-something.
We all are carrying files. He hit me with the file. He was banging it on the desk, and then he walked past me and kicked the box, swearing at us.
Sure. Wow. What are the unions saying about this?
Well, they're saying it's an ongoing problem that's always been there. The Department of Health doesn't want to take serious action about it. They've said that they've tried to engage the department for over 2 years now into going into safety drives for not only the doctors but healthcare workers as a whole, without any luck. They in fact say that the issue of security and the safety at these hospitals, because there's minimal security at the various hospitals, and even those security personnel are only armed with batons. And we heard some of those incidences from nurses saying that they've been threatened with being shot at because of how useless they are, as the patients would put it. So it's a sad situation, but what's more concerning are the stats that I heard from Denosa in terms of where South Africa is ranked when it comes to this patient, doctor and healthcare worker treatment. Let's listen to that.
It's actually very bad because I think about 2 years ago there was a study done by the Red Cross to say that in South Africa ranked amongst one of the top countries where, as a healthcare worker, you are likely to get attacked at work than a person who's a healthcare worker working in a country like Afghanistan. They are safer than us in this country. So it's actually very bad. So we need we need to get together to the table and be able to attack this from all fronts. But to say that it's not going to be just a Department of Health issue, it's something that needs to incorporate the incorporation of the SAPS, the municipalities and municipal police, your Metro Cops. But we need to have an integrated approach to be able to handle this. As a department on its own, it's not going to work.
Wow, so what happens in the meantime? I mean, are hospitals, I don't know, promising more security to increase that for these doctors?
Well, we couldn't as yet get a comment from the Department of Health in terms of what they willing to do. But Denosa says that they'd keep on engaging and continuing with this fight. But as it is, the doctors saying as much as they're passionate about their careers, passionate about patients and just helping the needy, they say they're afraid to go to work on a daily basis, especially Dr. Mandisa, following that incident, saying that she's shaken now. It'll be difficult for her to go to work tomorrow. She wanted to leave, in fact, that very moment and head home because she fears for her safety.
Yeah, and understandably so. Aviwe Mtila, thank you so much for bringing us that story.